Dr. Craig Benton. I'm a doctor of chiropractic at Benton Chiropractic Clinic, 105 North Key, Lampasas, Texas. Our phone is 512-556-8223. I'm here to answer the question, if you go to the chiropractor, do you have to go for the rest of your life? And the short answer is maybe. Here's why. This is going to be a lot of statistics thrown out at you, but back pain today is the most expensive condition to treat in the United States. It is also the most disabling disease in the United States, and it is the #1 reason to be on opioids long term. So the research shows that back pain is highly recurrent. So you get a flare up, goes away, and then it comes back again. The research actually suggests about 6% of those patients that have back pain have severe back pain that doesn't go away. They're the ones that have had multiple surgeries, shots, implants in their spine, all kinds of stuff. They get no relief at all. 22% will have a mild pain that will go away, that will never come back again. But over 70% of the patients will have a recurrence of back pain sometime throughout their lifetime. And what does that look like? Well, they may have no pain at all, and then a year or two later they'll bend wrong or lift something wrong and have severe pain. Or they may always have some type of pain, but they'll have these bad flare-ups that come and go from time to time that really incapacitate them. So there's been current research out there on chiropractic maintenance care and what does it do? Does it do any good? And that is where you come in about once a month for what I call a tune-up, to try to keep you functioning, keep you relatively pain-free, keep you moving like that. So this latest research, and I'm going to try to get this correct, came out in April of this year. The Nordic Maintenance Care Program. Maintenance care reduces the number of days with acute pain episodes and increases the length of pain-free periods for dysfunctional patients with recurrent or persistent lower back pain. The lead author is a guy from Denmark, Andreas Eklund. So you can look that up if you want to. But what they did is they compared people that went to the chiropractor once a month, and then they compared people that just came in on an as-needed basis. So they found out that throughout the year, the people on maintenance care came in about 2 more visits more than the ones that just came in as needed. But what they found is with the maintenance care program, these patients' pain was relatively plateaued. So they had some pain, but you didn't get these big spikes. The ones that would come in as needed, well, they had these big spikes of pain that would come and go and ebb and flow throughout the year when they got their flare-up. So the maintenance patients were shown that they had about 30 days less pain or pain-free days than the group that just came in on an as-needed basis. But what they also found out is that your functioning was better, that you were able to do things for about 10 more weeks than the people that just came in as needed. So when a person that came in as needed, pain was way up here on a graph, well, they couldn't do much at all. Their pain was relatively incapacitating. They had trouble working, had trouble doing their daily activities, trouble doing their recreational activities, so they didn't do anything. So the maintenance group didn't have these great big spikes like this. There was more plateaued, so they ended up being able to do things more for about 10 weeks out of the year than those that just came in as needed. So again, what has been shown to help more than maintenance care? Exercise, doing exercises. Be honest with you, most patients don't do their exercises. So what's that mean? That means that they're probably going to have a recurrence of pain. So I guess you could take your opioids if you want, but that's dangerous. You've seen what that's done. My recommendation is if you have recurrent back pain, maybe check out coming in once a month to see the chiropractor. That might do you a world of good. And again, thank you, Dr. Craig Benton. If you have any questions about this, feel free to message us here on Facebook, YouTube, or give our office a call. Thank you.